It's not there. Yeah, here it goes. Hello, everybody. It's me again, Paul Palmer. So today I wanted to talk to you about seal integrity testing. Now, I did mention yesterday, if I didn't get any specific requests, that's what I'll be talking about today. So here we go. Now, many of you will think, well, it's not really that important because I'm doing a non-sterile product, and seal integrity testing, well, it just seals it, doesn't it, on the platen? No, it doesn't. You have to do your seal integrity test. I'm going to explain to you why. So, a long time ago, my first exposure to seal integrity testing was a foil. Now then, what was it? It was PVC, aluminium, paper, tri-laminate, which was back to back. So you had two of the tri-laminates back to back with the pharmaceutical product inside. And we got regular failures. Now, we found it interesting that some of the operators had failures quite regularly and others didn't. So why was that? Well, we looked at the design. And to be honest, with seal integrity, that's the first place to look always. In fact, many problems, look at the design. And you'll find, we found that with the design, sometimes if it wasn't exactly lined up, then the I don't want to call it serration because I don't think it's serration. It was peaks and troughs on the on both sides of the seal platen. So the platen is the bit that pushes it together. So it's pushing it together, and you wanted it to push together like this. But sometimes we were getting it pushing together, and it was going peak to peak instead of peak to trough. Hi, Valerie. Nice to see you too. So if you are doing seal integrity testing, if you're setting up your machine for integral seals and you do them peak to trough, then you get a good seal when it compresses. The temperature varies a bit and it does make a difference, but not as much as having it aligned properly. Now, if you get one corner because you're going round the corner and they're misaligned, you get seal integrity failure. Now, this product was sterile. So what happens when you've got a non-sterile product? Well, you're putting your patient at risk because you've got potential ingress of contamination. So it failed. So what did we do? Well, we looked at the design and we thought, there must be a better way of doing this. But in the meantime, we were thinking, well, how do we validate a process when we don't have a method that gives us rapid feedback? Because the method we were using was putting it in an oven, leaving it, I think it was 4 to 6 hours, maybe even overnight sometimes, and then looking the next day to see if we could see leaks on the outside. Now, this was a petroleum jelly-based product, so the actual egress of the petroleum jelly was taking a long time. We needed to heat it to about 70 degrees, and there was some question as to whether that could cause integrity failures in itself because of the failure of the sealing faces, because it was PVC. It was the PVC melting such that it actually came apart. Well, I don't believe it was. And the AI Qualipack that we introduced demonstrated that sometimes it passed, sometimes it failed. So I was involved in doing the validation of that Qualipack, and the Qualipack tester gave us definitive results by pulling a vacuum and saying, yes, it passed, or no, it failed. Now, it's not a Pharmacopoeia method, I must add. Pharmacopoeia method that we were using on a different product uses the pelican ink test. And that's the one that I'm going to talk to you about in a few minutes as well. So what did we do to investigate? Well, we got them to realign. We got them to change the way it was set up. We got them to buy new platens. We got them to demonstrate that the temperatures were correct. But in the end, we realized that it was this misalignment. And it was really easy, unfortunately, when they were setting it up for them to get misaligned. And then we realized that if there was any creep, all it took was 0.5 millimeter in the creep of one not aligning with the other. And bear in mind, this is 4 ways. You're doing all 4 sides in one go. It wasn't like we were buying in the pouches and just sealing the top. No, we were sealing all 4 sides and we were sealing sequential packs, all 4 sides. So you've got a high risk of some creep of one failing to hit the other. And on top of that, the platen on the above that was going across was having to cut the packs as well. So we had to align it with the foil to make sure it's cutting the packs in the right place as well. So the chances of failure were really high. And then we added onto that the batch coding. So we got regular failures. When we got the failures, they went back and did the setup. We did a retest, and often they passed and often they failed. So we had high waste. So what did we do? We looked at the design. And when you look at the design of these things, you think, well, it's just a nightmare. You're going to get failures. So what do? We changed the design. This was going hot seal with a serrated edge. I can't remember the proper name, but let's call it serrated. So we went to cold seal, flat seals, which are not available at the time when we purchased the machine. So we went to cold seal, flat seals, and it was sealed by pressure instead. Misalignment didn't matter so much because you didn't have the two that needed to integrate at the right location. Instead, flat to flat. Well, flat to flat there is the same as flat to flat there is the same as flat to flat there. You still had flat to flat. So we went and did the validation on the methodology. We got passed. Well, should I say it? We already had it validated, put it through the QualiPack, it passed. So we updated all the machines to a design that was designed to pass, that was designed to seal appropriately with minimal intervention and had a significantly lower failure rate because the design space for that methodology of sealing was much wider. They had, I think it was 15 to 30 was the operating range, and all you did was increase the pressure a bit if it failed. So we had significant reduction in waste, significant reduction in integrity failures. We didn't bother anymore with the long seal integrity test in the oven because we had a methodology that we demonstrated by comparison, one against the other, that it worked. So when you're looking at a seal integrity to failure, don't assume it's the method that's the problem. Always consider, is the product designed appropriately? Is that compromising the integrity of the pack? And then look at the machine as well. Is that compromising the integrity of the pack? Because it might not be anything to do with your integrity method. Now, let's move on to Pharmacopoeia methods. So imagine you getting a Pharmacopoeia method, you're straight out of the Pharmacopoeia, and you think, right, I'm just going to use this method. Bought it off the shelf. If it's off the shelf, do I really need to do validation? Maybe I do, maybe I don't. Well, we've got behind me, I'm pretending to be inside the seal integrity tester because I thought that was funny, but I can't work out how to pretend I've got a screen in front of me. I can't go inside it, which would have been even funnier. So this is a Pelican ink methodology with clear Perspex sides so that you can see what's going on as the ink test is progressing. Now, this is an interesting piece of kit. It's different to the one that I used to use. I used one that was, well, it was the same principle, but it was glass on glass. And you probably know glass on glass seal integrity can fail. So we used to have to put the petroleum jelly around the edge. So glass on glass, petroleum jelly. We had the suction in the top. And I don't think we needed the clamps on the sides, but we had clamps on the sides in case. Pull the vacuum. I think we used to put the Pelican ink onto the inside, did we? I don't remember now. Anyway, it was a Pelican ink test, Pharmacopoeia test. And what did we find? Sometimes it passed, sometimes it failed. This was a different product. Now, I got involved in all the investigations. Whenever something failed, I was there helping, looking at the machines, because I was the supervisor. I wasn't the QC analyst. So I was supervising them. And anytime something went wrong, they said, well, it's not working. It's failed. What do I need to do? And then I go to the operators, and what's the problem? Oh, we've had these problems with this, that, and the other, and the setup was ages, and blah, 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 blah. Goes to the engineers. Oh, we've got these problems with this one, and we need to replace this, and we've done this and done that. And we used to get it to pass. So there was a whole range of scenarios that can make it work and others that can make it fail. And I got involved in all of them. So I learnt loads of different options. I learnt so many different things about validation of integrity testing, about setup of the machines, about how the method itself could fail, about what was appropriate for qualification, what was appropriate for full process validation. And then we applied it to other products as well. So we had the hot seal, we had the cold seal, we had the paper, we had the foil, we had alu, direct compression. I don't think that had PV. It wasn't PVC, that was PE. PEC or PEV, I think it was. I want to say PET, but I'm sure PET was a different product. It was plastic, then foil. Now, this one came as a pouch, and we were sealing the top, but we were sealing it really fine. And we had fun getting that one to work because it was also with a product with 70 degrees C inside. So it often didn't set properly, and it was still too high a temperature, and you took it away from the jaws. So that was fun. It was interesting validation because there was more than just the seal integrity we were validating. So what's next? Well, how did we deal with that? We put the product to cool before we put it into the pack, before we sealed it. And it worked better. Now, seal integrity method. Move on a bit. Going to going to audit a site. Now, bear in mind that I've got all this knowledge of this method and the understanding of what happens when you want to try and validate it and how it can go wrong. And how sometimes you'll find that the way that you follow the Pharmacopoeia method doesn't mean that it works for your product. So I'm looking at this method, and I'm looking at their, it was a blister. It was a blister pack. And I could see that they had the tablets inside, and I asked them to demonstrate. So they put it in, they pull a vacuum, and I thought, that's not enough ink you're putting in there. It's not enough ink. It was a really low concentration of ink in the was it? Can you call it a chamber? Do you call it a cylinder? No, it was like in the bowl, in the bottom, in the water. So to me, the ink concentration was too low. So I thought, right, that's not going to work. So I said, okay, prove to me that it shows when you've got a hole in it. I said, make a hole in a pack and put it in again. And they didn't want to, of course. But when you're the auditor, you can tell the boss or their boss. And they say, go ahead, do it for us. And we made a hole in one of the pockets. And they took it out and they did the standard test. And it passed. There was a whacking great big hole in it. And the seal integrity passed. Because they couldn't see the contamination on the tablets. So they did their standard methodology. It didn't work. And I showed it to the engineer, the person that worked with the validation and the setup. I showed it to the QA and I showed it to the production, and they all agreed, no, it don't work. So I says, okay, that's going down as an observation. But it's the Pharmacopoeia method. But it doesn't work. But it's Pharmacopoeia. It doesn't work. If your Pharmacopoeia method doesn't work and you've not proven it does work, you can't use it. You don't have to do full validation, but you still need to prove it works. That applies to the Pelican ink test. It applies to any test. If your method you are using has not been qualified for your product that's been packed in the way that your product is, you can't just accept, oh, it's a Pharmacopoeia method, so it must work. Now, this brings me to an interesting scenario. You see, I used to work with somebody that recommended the Pharmacopoeia methods to go into the British Pharmacopoeia. So I asked him, what do you do when you submit the method? What do? You write the method and you submit it. You don't demonstrate it works. You don't do any validation. And he complained because some of the other methods in there were terrible and they didn't work. But they didn't work for our product. And they did work for somebody else's. But they got in there as the standard method for the Pharmacopoeia. But it didn't work. We had to adapt it. We had to qualify it, validate it to prove it worked so that it could go into our regulatory module 3. I think module 3. Yeah, module 3 for use as our license application, because using the Pharmacopoeia method failed consistently. It didn't work. Now, this was chemistry. As analytical chemistry, it wasn't the seal integrity test. But it just shows you, if you're using a test for your product, even if the Pharmacopoeia says you can do this, make sure it works for your product. Because who's responsible for ensuring that the product you place on the market is the right safety, the right quality, and the right efficacy? Now, I've been working with a product that's susceptible to moisture. One of the products that I release, and we have problems with it because we have the capsules sometimes are brittle. In the past, anyway, they have been. So I went over there to do the audit of this site. And guess what? That's the same site that had the seal integrity method that didn't work. So what happens if your seal's not adequate? Well, if your seal's open, or you've got a hairline, or you've got something else which has actually punctured it, and the moisture from the normal air goes into that pack, guess what you get? You get brittle capsules because the moisture in there makes them brittle, and that's what we had. So to me, sealing that problem went away. So that's it for me for today. I hope you found it interesting, and I hope you understand why I wanted to talk about seal integrity today, because for me, it's a critical part of the process, and it doesn't get enough attention. Sterile products, of course, are always have their seal integrity test method validated. I say always, of course, but you never know. I might go somewhere where it isn't. And if you're being audited by me, I will look. But it's just as important for a non-sterile product. If you've got a non-sterile product, which is open, but it's susceptible to moisture, and the moisture comes into that product because your seal integrity is inadequate, then it may be that it's no longer efficacious. It may be that you've increased the amount of degradation products, and maybe you've formed some formaldehyde. Now, that's not something that you want in your product that you're placing on the market for a patient to take, is it? So just be careful. And I recommend you go and have a look at those products that you've got on the market. No, you go and have a look at those methods that you're using. And where it says Pharmacopoeia, make sure they've done the qualification work, because you can't assume they work. Okay, that's it for me for today. It's Paul Palmer. I'll talk to you soon.